Welcome back to Male Nurse Mentor. My name is Jesse. Today I'm going to give you the scoop on what it is actually like to work with inmates. And I think some of what I'm going to say will actually surprise you. The purpose of this video is to continue the series I eventually want to complete on correctional nursing. I always want nurses to have options in their career. Correctional nursing for me was a saving grace. It helped me as a new nurse find the spot for me when I didn't want to work in a hospital, when I didn't want to work in a standard patient care setting. The problem though with correctional nursing is it continues to be a very tight-lipped nursing specialty. You won't find very much information on it. This is why I, having worked in that setting, want to make videos on this subject. So I'll be sprinkling videos like this over time. But just know if you have any specific correctional nursing related questions, reach out to me, find me on Instagram, send me a DM message with any of your questions. Make them as specific as you want, I'll get back to you. I just want someone like myself, having had already nearly 6 years of correctional nursing experience, to help bring those people interested in correctional nursing a little bit more at ease with their decision, as opposed to me when I went in pretty much blind. I only really saw a couple posts on Reddit, maybe a few on All Nurses, but they were always very old and I went in blind. I want the nurses that are going to go into correctional nursing to go in with already an understanding of the expectation working in that setting. Because it is unique, it has its own challenges in different ways. The more informed you are, the higher there is a chance for you to go into that setting and then stay and like it. I'd rather have nurses know the scoop, the full scoop of the correctional nursing setting. This way they have all this information readily available right at the time they apply. As for a little bit about me, I already shared a little bit. I did work nearly 6 years in the correctional setting. One thing to mention is I've worked both in the county jail and the prison setting. And then within those settings, I've practically worked in every single area you can work as a nurse. I even worked during the pandemic. I got an interesting experience. So experience that I do come to present in these videos takes all of that information into account. So one thing to mention is use the timestamps down below as you continue to make your way through this video. If you want to jump from one section to the next, at the very end, I am going to have a story time. I've picked, I think, 3 stories that I do want to share with you guys to give you guys an understanding of some things, kind of like the dynamic to expect between a nurse and a patient, and some scenarios. Story time is always my favorite part, but I put that at the end. So if you're curious, stay tuned or jump to that part. But just know in this video, I'm going to be breaking it down, trying to explain it from the jail perspective and also the prison perspective. And then after that, I'll just give you an overall summary of what to expect working with the correctional inmate patient population. So let's begin. All right, friends. So starting with the jail setting. So I wrote a couple markers down because I want to make sure I actually touch on the points I want to hit. So if you see me looking off the screen, I'm reading my little points here. So this first one is for every 10 inmates, 8 will be respectful to you. You're gonna have no issues with these inmates. It might be very normal and similar to working with a patient at a hospital, a patient at a clinic. Same deal, right? You come in, you're professional, patient is being a really good patient, solid, no issues. The other 2, right, the 20%, that is a percentage of the patients that you're gonna face in the county jail that aren't respectful, that aren't polite, they're not the normal patient. But as you can see, based on the percentage, it's also not the normal, right? The normal is the 80%. So just keep that in mind. But you can expect these patients to be combative, argumentative, hostile, and there's always going to be a lot of yelling. These patients come in hot. They come in hot. They're not in that setting because they want to be by choice. It is all against their will, right? These people are arrested. They're angry. Most of these people already have anger issues. It's often these anger issues which cause these situations that they find themselves in to elevate to the point of getting arrested. So there's going to be a lot of yelling. So do know if yelling is something that triggers you in some way, maybe the jail setting may not be the place for you. Just to put it bluntly, there's a lot of yelling. Even if there's patients, inmates, not yelling to you, you're gonna be eating your sandwich at your work computer down in booking, and you're just gonna hear all these intoxicated inmates, pissed off inmates just yelling yelling all the time. When I was working in the county jail, I got to the point where I'm just eating my sandwich. I had one guy cursing to the heavens, and the guy next to him saying he wants to kill himself on suicide watch, and then someone else complaining about some girl that he's having problems with that caused him to get in the jail in the first place. So you're gonna hear all these things. So yeah, I'm just getting flashbacks right now as I'm describing it. Another thing with the jail versus the prison, in the jail, these inmates are often a lot more unpredictable, and there's gonna be a lot more withdrawals in jail. Oftentimes they go hand in hand. People who are going through withdrawals aren't themselves, right? The people that have gone through withdrawals, or if you've seen anyone go through withdrawals, it's a pretty difficult thing to witness. These people are clearly very uncomfortable and not having a good time at all, to say the least, but their body is physically going through a reaction. Their body was dependent on the substance, whether it's like heroin, oftentimes it's heroin, or alcohol, right? We in the jail setting have a protocol for it, but no matter what protocol they're given, they're always uncomfortable. They're gonna kind of be snappy and irritable. And because of that, these people are unpredictable. Now you also get people who lied to you during booking, right? I'm good, I'm good, I'm good. And they actually end up having some episode, right? Maybe some psychotic episode, and they're unpredictable, or just in general, right? People who are angry are gonna be unpredictable as well. So all this to say, what you're gonna realize working in the county jail is this patient population 80% of the time is gonna be chill, easy to work with. 20% they're gonna be combative, argumentative, and also unpredictable. Like when I was making this video, I was thinking about it. I was like 80%, 20%. I felt like that was pretty good, right? Just from my overall experience. 20% of the time you're gonna be worrying. 80% of the time, it's gonna be normal. It's gonna be fine. You'll be in that sandwich at your desk, waiting for the next guy to come in. Or girl. These girls come in here too. Don't get it twisted. So speaking on this 20% a little bit more, right? It's like my 20% rule. It can be quite traumatic, right? Most people have never seen this part of humanity. It's actually a very dark side, and it's extremely depressing, right? It's a very depressing part of humanity to witness this side. And this is the side that most people will not see. You just won't. Maybe you get little glimpses, whether it's a video on the news or you're out and about and you happen to witness, somebody who actually gets arrested. You can see how traumatic that is, especially if the person is not cooperating. This is the dark side of humanity. And then just to know that these people are this broken sometimes, right? It's actually really broken my heart on many occasions. Oftentimes that when I've witnessed that working in the county jail, there's no way to actually just do your job and not feel that. Right? Not feel what you just witnessed, right? Of that person's life. You're witnessing a person's rock bottom. Maybe they committed a crime, which also throws in this whole twist into it. They hurt somebody else, and now they're here hurt themselves. It's not easy. It is not easy, and it's just something to keep in the back of your mind and take into consideration when you're trying to work with this patient population. And then just to further the point of this, I wrote, just to give you an example, imagine you're out in town and you see those people that look like they're on drugs or going crazy, or they're very intoxicated, or they're acting violent, right? Those people go somewhere. Those people often end up county jail, right? Because they get arrested. As a nurse, you will be the person that does the assessment when these people go and get booked in county jail. So just think about that, right? You will be the nurse that has to talk to these patients, come face to face with these patients. Granted, they're in handcuffs, they're in restraints, but still, right? You saw that person. You can imagine what that person would be like to work with. So just imagine working with that person during your job. It's kind of hard to describe it fully apart from how I already described it. So a lot of this is just imagine. Just imagine. I can't. Pretty intense, guys. Working in the county jail is pretty intense. I equated it to just working in like a circus or a jungle. It was just a lot. It was just a lot. I'm not gonna lie to you, I'm not gonna sugarcoat it, but that's what I was looking for. So I guess, I'm odd like that. There's people who look for action sometimes and just wanna work amongst all that stress and chaos and anxiety and just work in that environment. I was craving that. I got that when I worked in the county jail. So I just wanted to be transparent and let you guys know. But with that said, we're going to the prison now. Let's talk about the prison setting. So what I wrote, in the prison is actually very calm and peaceful, which is going to be noticeably different from the county jail. Noticeably different. It was so different for me when I went from the county jail to the prison setting. It felt odd. I was always on guard so much that I was like still feeling like I was in the county jail. But it took me a couple months to just kind of lower my guard and feel like, hey, it's different. These guys don't act like they do in the county jail. And for me, it was almost an eerie and a quite odd feeling to just noticeably see the difference. And just exactly how normal each day working in the prison felt. It actually felt pretty normal. So normal, in fact, that you actually do forget that you work in the prison setting. I would forget all the time until, I would get reminded about a stabbing on the yard, right? An inmate on inmate assault, right? And then a stabbing included with that. And then you start to see the pieces of the stabbing equipment that these inmates would make and they would use on each other, and they're really long, real thin. But you get reminded quickly in those moments, oh yeah, these guys are dangerous. But apart from when that would happen every once in a while, every day was normal. Every day was normal. Hey, saying hi, good morning to the inmates, and then you forget until someone gets stabbed again. Here in the prison setting, as opposed to the jail setting, right? The jail setting, we said an 80-20, 80% normal most of the time, and then 20% just chaotic. In the prison setting, I would say it's like a 9 out of 10, even maybe 9.5 or maybe even 9.8 out of 10. It's so normal most of the time. Like I said, you're gonna forget you work in a prison. You're not gonna have any issues with any of these inmates, practically ever. It's just noticeably different from the county jail. It's almost strange when an inmate loses their temper, comes out of character in the prison setting, because you have a bunch of other inmates who are looking at the guy like what are you doing? Like that, it's abnormal to lose your character. And there's a reason behind it, and I'll mention it here in a bit. And then as far as staff assaults are, at least from my experience, a lot less common compared to the county jail setting. In the county jail, you would see a staff assault of some sort at least once a day, right? During your shift, you would see some type of assault on staff. And it's often because inmates come in hot, hostile, argumentative, they just committed an act of violence. They're still in that state of violence, right? And they're in handcuffs, and they got to switch handcuffs, get the guy booked and all that. And oftentimes the guys are angry, not cooperative. So yeah, you would see some sort of scuffle between the officer and an inmate. Not for every inmate who comes in, but for those 20%, right, inmates that you would see. So in the prison, that's a lot less common. Staff assaults do happen. From my experience, they have happened. You hear about them. I've seen officers come into the healthcare clinic area, right, the treatment area, because they've been assaulted or gassed. To get gassed, it's a fluid, right, feces, urine, all this stuff mixed, nasty stuff mixed and thrown into an officer's face. That is still technically an assault. The assaults themselves in the prison are a lot less common, from my experience. So just one thing to mention. And as far as healthcare staff goes, they're pretty much off limits from my understanding. I have been there long enough to know healthcare staff that have been assaulted in some way. It is less common. It can still happen. But speaking with inmates themselves, there's technically an off limit rule when it comes to healthcare staff. Healthcare staff are not supposed to be getting touched at all, but it can happen. You got to understand this, that when you work in a prison, that is the environment you work. It can happen. Just keep those things in mind. So one thing to mention here is in prison, the inmates really do police themselves. I've seen it. I've actually treated the shot callers when you think of the politics on the yards. If you've seen the movie Shot Caller, that's a good interpretation of what it is kind of like to work in a prison. If you know what a shot caller is or don't know, you can Google it. I can give you just a summary of what it is. It is pretty much the head person of a gang in a prison. They pretty much run the yard, or sometimes even run the prison, right, when it comes to specific gangs. I've treated the shot caller in the prison setting medically. I've seen how they move with other people around them. They are in there. It is real. The politics of the prison setting are real. And because those politics do exist, they do police themselves. It's very interesting to witness. These inmates are in prison. You have officers kind of keeping them in line. And then within the inmates themselves, they have another layer that keeps them in line. And that is what is known as the politics. You have shot callers and other people pretty much telling them how to operate, how to move, and stuff like that. Very interesting. But because that exists, it's so normal, so peaceful most of the time in prison. I would say they police themselves more than officers policing them. if that makes sense. Very, very interesting to witness. I also made some notes here about in prison, these inmates are a lot more predictable, a lot less withdrawals. And just speaking on withdrawals, there's a lot less in the prison setting because they're continually getting a source of whatever drug they use. It's a known thing that there's constant drugs in there because guys are constantly getting high and overdosing and things like that. So because they continue to get the source, a lot less withdrawals behind the prison walls. And another thing that I mentioned here is everything is in a very unique order. Inmates just have more to do. Some work, some go to school, they have yard time. And on this yard time, compared to county jail, which is like a very boring cement yard, barely get any sun. Here, they're out in the sun, they get a big old track, and they have handball, all these different pull-up bars, basketball courts, a football field, soccer. So they do get yard time, get an area to kind of work out, clear their mind, release some steam, keep the balance in the prison setting. And my last note here, when I went from county jail to prison, I quickly realized how easy the prison was to work inside, especially compared to the county jail. So my tip is if you want even more correctional experience, more of the action, you go to the county jail. If you go to the prison setting, it's a lot more established. These inmates have been there for a while. Some of them are going to be there for life. So it is their home. So they kind of want to keep it peaceful because it's peaceful for them. They're trying to keep it peaceful for themselves. It's somewhat going to be peaceful for you just by default. County jail, jungle circus, a lot more action 20% of the time. 80% of the time it's normal, chill. A prison setting, it's chill and peaceful, 9.5 out of 10 times. And then the 0.5 that happens, it might be something very violent. Maybe someone actually dies from a stabbing. Maybe someone dies from an overdose or other things that happen in there. Apart from that 0.5, the other 9.5 out of 10 times, it's very chill. So chill you forget you work in a prison. Apart from the barbed wire, all the fences, the electric fence, taking a mile walk to get to your desk. Besides all that surface stuff, right? You kind of forget you work in a prison. All right, so we talked about the county jail, talked about the prison, what to expect working with the inmate population in each of these settings. Now I want to give you guys the overall, just my overall summary of what it's like to work with inmates, right, in this patient population. So my thing is, it may surprise you. If I had to summarize, even including county jail with the prison setting, inmates are very respectful and most of the time very polite and appreciative of the work we do and the care we do provide to them. It's not all perfect. The stereotype of how it may be to treat an inmate does happen from time to time. For example, some can get really nasty and argumentative and threatening, but it is really not that common. And the nice thing, when they do act out of character, because they eventually will at some point in time, there's an officer nearby and you just say, hey, we're done here, we're done, and the encounter concludes, right? Because safety and security always takes priority in a correctional environment over medical care. It's just how it goes. Even if a guy really needs to be medically treated, but he's being hostile and argumentative, you could just say we're done, because your safety, your security actually matters first in that type of situation. But overall, the inmate population is really not that hard to work with. Yes, they are in jumpsuits or inmate clothes. Yes, you'll see chains and handcuffs, you'll see officers everywhere, but once you get past all that surface stuff, you are a nurse, they are a patient, it's everyone's job to be professional, you and the inmate, and the majority of encounters actually do go smoothly without issues. All right, friends, so if you made it to this portion of the video, this is story time. I have a total of 3 stories. I'm not gonna make them very long. They're gonna be in condensed format. But I got 3 of them. I got 2 from the jail. I got 1 from the prison. Let me get a sip of coffee. All right. So this first one, I call it 0.32. So this is in the county jail, right? This is me working intake, working booking. In the county jail, when someone gets arrested, let's say they're heavily intoxicated, drive their vehicle, they get a DUI, right? Get pulled over by the cop. They'll come through intake, and then from intake, which is the nurse, they go to booking, get processed, get their photo taken, stuff like that. So when an inmate gets arrested, they're brought in by a police officer. Police officer cuffs are on that inmate. When I clear them, the police officer takes off their cuffs, and the county jail staff officer then takes the inmate and walks them through the booking process. So for me, I'm working intake this day. I have this guy come in, clearly, he's a little bit intoxicated. I could smell a little bit of the alcohol. I only say a little bit because I could just tell. I've been working this job for a bit, and I could tell when someone's intoxicated, slurring their words a little bit, but for the most part, making it through the questionnaire, right? I could sense he was drinking. Part of my questionnaire is to ask if he's taken any substances. Of course, the guy says no, didn't take anything. And the thing is, they don't have to lie to us, right? They think that by telling us the truth, they're gonna get in trouble by the police officer even more. But once they're there, it's all a medical assessment. It's protected by HIPAA. The officer is just there for the safety of everybody. So I tell the inmates this, but still, they still lie. I only was saying this guy was lying because you'll find out here pretty soon. But the questionnaire that I do as a nurse, it's very extensive, very extensive. I go from like history of potential emergency contact, getting their phone number, address, any medications that they take, any medical history they have. And then I specifically have to ask very specific questions, one at a time. It's like 30 or 40 questions. So to make it through this whole thing, like you have to be pretty alert, right, to answer these questions. I notice when guys are intoxicated, they're barely hanging in to this questionnaire. They're having a very difficult time, right? I'll ask them a question, they're kind of like dozing off and kind of like falling asleep, I could tell. This guy, he's just kind of slurring his words a little bit, but it's okay, you could lie to me. I know you drank something. I'm not too concerned about how much you drank. You're making it through this questionnaire. If you can make it through this questionnaire, you're good. Anyways, at the very end of my exam, right, I ask him again, hey, did you drink anything like alcohol or anything like that? And he's like, no, nothing. I was like, are you sure? I just really need to make sure for your safety, right? Going through the booking process and then in the holding cell, I just got to make sure you're going to be okay. Are you sure you did not drink anything at all? No alcohol. He's like, no alcohol, sir, no alcohol, not even a drop, not even a drop, nothing. So now we're done with the encounter. The guy walks out with the county jail officer, right? The police officer stays back and he's like, hey bro, do you want to know how much that guy blew? I was like, I'm shook right now. It's like, that guy was answering all your questions. You know what he blew? I was like, what did he blow? He's like, 0.32. 0.32. I was like, dang, 0.32? The legal limit is 0.08. And the guy was still here talking to me, making it through a whole questionnaire, telling me I didn't drink a drop alcohol, not a drop. And he held it together. He held his liquor together, his poor liver, his poor liver. That was the highest alcohol reading I was ever told about working in the county jail. My man was operating a vehicle at 0.32 and still not even down for the count. The guy made it through a whole questionnaire with me as a nurse, lying to my face, telling me not a drop of alcohol. Crazy, crazy. All right, this next one, I call this next one K-drama yeller, okay? I only call it K-drama yeller because the picture I'm gonna paint, it's the only way to describe it. I don't know if any of you guys have seen Korean dramas. So I had this Asian lady come in. She looked actually really well put together, right? I've been working county jail for some time now. I could tell when someone's about that life. I could tell when someone's homeless. Like I could tell when someone's just a normal person just getting caught for something. I could just tell. This person was like an Asian lady, like in her 30s, right? Really well put together. Her hair was straight, looked like she takes care of herself, had makeup on, and was wearing like a nice coat, nice clothes. I don't know what happened. I have no idea to this day what happened. But she came in, officer brought her in, put her on the chair in front of me. I was like, hey, my name is Jesse, I'm gonna be the nurse, I gotta do an exam. It's just a questionnaire. Nothing, flat effect, nothing. I was like, hey, can you just tell me your name? Nothing. Go to take her vitals, nothing. Just so withdrawn, looking at the floor the whole entire time. No eye contact. I get close to her and I'm just like, hey, miss, I need something. You gotta give me something. Like your name, can you look at me? Like, I just need to know you're okay, right? Nothing. And I'm going through my questionnaire, really trying to ask her these. I give her a decent opportunity. The thing with situations like this, guys, is people who are like this, withdrawn, the concern is anything with mental health and suicide, right? These people can actually hurt themselves. So if I can't get anything, I can't ensure their safety being in the jail. And it puts me as a nurse in a very tough position, right? There's no reason for her to go to a hospital. Her vital signs were fine. She's just not answering any questions. I call mental health. They were unavailable at the time. When mental health comes, they'll do in real time questionnaire, right? Their screening process. And they'll determine if the person needs to be in a safety cell, right? A safety cell is the cells for suicide watch. It's like a padded room, but the people when they go in there, they get stripped of their clothes and given a smock. And it's all to protect and ensure their safety. It's just protocol. People have their own opinions about it. I'm just telling you how it is. So I call mental health for them to do this screening on her because my concern is she's gonna hurt herself here, right? I'm not getting anything from this lady. She's so withdrawn. I can't ensure she's gonna be safe, right? Or keep herself safe. I call mental health, they're unavailable. I was like, shoot, all right. I gotta make a decision here. I'm like, hey, miss, like, this is where we're at. I just need to know you're gonna be okay. I'm trying to do this questionnaire. You're not telling me your medical history, that's okay. You don't have to. I took your vital signs, they're good, they're normal. However, I need to know you're gonna be okay. You're not talking to me, you're very withdrawn. Because of that, I called mental health, they're unavailable. Because of that, I'm gonna have to put you in the safety cell. And she just lost it. That was the one time I finally got a reaction from her, and she just starts yelling, screaming, like just like literally like a K-drama scene. Like, I kid you not, she started rocking back and forth, just yelling at the top of her lungs, just shaking her head. I was like, man, I and the police officer who were in that room were just like flabbergasted. We were just like, oh my God, yelling at the top of her lungs. And that was it. You know, the officers got her, like she wasn't putting up too much of a fight really, but she was so in distress, just shaking her head, talking in her native language, just beating herself up mentally, internally. And I don't know what she was in there for. Calm as can be, so withdrawn, and then just jumps into one of those K-drama yells and just like shakes her head and just going like insane. That was hard to watch, but that was the K-drama yeller. So now those were the county jails. I got endless stories, friends. This next one is gonna be about the prison. This one, I call this one Rookie. It's right when I was first starting in the prison setting. I had one of my first emergency responses, and you know, I was getting called Rookie all the time. So I'll tell you guys about it. So I was new. I think I was still on orientation actually, maybe about a month in. Orientation is very long in the prison setting, if you're wondering. I think it's about 8 weeks. So we did 1 month of class. I was finally getting on the floor, and I was paired up with someone who was like my preceptor, right? And I was in the TTA, which is like the small triage and treatment area. It's like a small ER. It was me with the more experienced nurse. It's actually night shift, right? There's a medical code that goes off during the night. It's not very common. During the night, it's very slow. But there was one code that night, and this was the code. Medical code is an emergency response request from inmates in the building or an officer. And the code itself was for active bleed. So I was like, okay, you know, we got active bleed, we gather up, we get taken to the building. And when we get to the building, I get there, I see the guy on the ground. You know, he's alert, oriented. He's just holding his leg with a really big towel. And he's like, man, this is bad. It's bad. I was like, what are you talking about? What do you mean what's going on? It's like, it's bad. Like, I'm bleeding bad. Like, I'm bad. You need to help me. And I was like, all right, man, I hear you. I see you're holding the towel down. I don't see any blood right now, but he's like, I'm bleeding. I am bleeding. I am telling you I'm bleeding. I was like, okay. I'm like, I gotta see it though. I was like, let me kind of take over here. I kind of have to see what the bleed is. Like, no, you don't. No, you don't. You don't got to see anything, man. I'm telling you, I'm bleeding. I was like, all right, I hear you, but I really do have to see it. I can't treat it if I don't know what I'm treating. Like, I have to see it. All right. I was like, just let me know when you're ready, okay? So he's like, he finally agrees. He lets me kind of take over the towel. I remove the towel for a split second, like probably like at max a second, a literal second. And I remove the towel just to take a peek, and blood just squirts across like 10 feet. Like, it just shoots out. And all I remember is seeing that, and I put the towel right back on his leg. And I was like, okay. He's like, oh. The guy was okay. He was a really large guy. He was okay. But the reaction of everybody, myself included, the inmate, the officers, seeing that blood just shoot across the room was insane. I've never seen something like that before. I'll tell you now, it turned out to be, what's it called? I was blanking out for a second. It's called a varicose vein. The guy had some varicose veins. Supposedly he said he was laying in bed and you know, he kind of scratched his lower leg while he's laying in bed, and you know, he goes kind of to lay down more, and he kind of just feels like a drop just kind of hitting his face a little bit. He's like, what the hell? He kind of wipes his hand, and he sees his blood on his hand, and it makes him panic. He's like, what is this going on? And he looks down at his body, and he sees his leg laying in like a pool of blood, and that's how he knows he was bleeding from his leg. Craziest thing ever. I'm not even joking. Back to the scene, right? I know it's actively bleeding. Well, the thing is, when we get a medical code, we come with a whole bag of equipment, right? We actually have like, it's called Quick Clot. It's like literally the gauze with the clotting factor that they use in the military. It works very, very well. This was the day I realized it. We also have tourniquets. So clearly I'm concerned about his active bleed. We call 911 from the building. All that's initiated, but I treat him. I get that Quick Clot. I wrap it around his leg, put the tourniquets, and take him back to the TTA, which is a mini ER. In the mini ER, the guy's stable, right? We stop the bleed. I'm trying to put an IV in him. He's a large guy. He's like, hey, they never get IVs in me. I was like, well, you know, I'm not great at them, but you know, let me try. I didn't tell him that. That's what I was thinking. And I actually get it. I blow it though, you know, due to lack of experience, I blow it. But anyways, during that time, the guy's calling me a rookie. He's like, hey man, I haven't seen you before. He's like, yeah, you know, I've been here like a little bit. He's like, you're a rookie. You're a rookie. But like in a funny way, he was calling me rookie. He's like, man, Ricky, like, you know, I appreciate it. And from that point on, every time I'd see him in the prison, he'd always call me rookie, and he'd always be appreciative of that care that I provided for him that day. That one's called Rookie. I just call it Rookie because the guy called me Rookie, and then eventually he stopped calling me Rookie because, you know, I've been there for almost 5 years. But anyways, friends, those are the 3 stories. I got a lot more. If you guys enjoy the stories, I can always share more. Maybe when I make correctional videos, I'll throw some stories in with them. Who knows? But this whole video was just to give you guys an example of what it's like working with the inmate population. Hopefully some of this was helpful. My main thing with this channel, friends, is just to continue to give you guys information that I hope is helpful for you guys, whether it's in deciding to become a nurse, whether it's in deciding to pivot from one nurse specialty to another. Just know I'm here for you guys. I'm always around. I'm still actively working as a nurse myself, trying to figure this out for myself. But the idea is I've gotten to a decent place in my career. Now I just want to give back. As always, friends, thank you guys for watching, and I'll see you on the next one.